would be a fun interview to talk about your practice. I'm Dr. Michele Kurlanski with Lighthouse Foot and Ankle. This is Dr. Heidi Larson with Heidi Larson MD, Family Medicine. She's a direct care practice and does primary care, direct care, and I do podiatry. So just wanted to chat. It's fun to talk with someone who does what we do. So
thanks, it is fun.
Yeah. So all right. So I guess the first question I want to ask is, why did you choose direct care?
I chose direct care to get away from the churn of traditional models. I like spending time with my patients, and I think that the value of what we do is based on building trusting relationships with our patients. In a more traditional model, we're really confined by the structures of the payment model and the pressures to increase our volume, and that ends up giving us 5 to 7 minutes per patient on average, which just isn't enough. I love being in this space where it's peaceful and quiet. I love feeling like I have time to really listen to my patients and hear about their days and share in their lives, and I think that that really contributes to their overall wellness and health, and mine too, for that matter.
Great, that's awesome. Yeah, and the space is nice. It's just a nice to see out the windows and see the trees, and it's great
peaceful.
Space. It's peaceful. Yes. So yeah, what surprised you most about having a direct care practice?
Yeah, I think what surprised me most was how difficult it is to grow the practice. And I think that the barriers there are in helping people to understand its value. People hear $85 a month and think, oh my God, that sounds so expensive. But if you think about it in terms of your overall cost of your health care, if you have a high deductible plan that's HSA compatible, and you use those HSA funds to pay the $85 per month fee, it's actually a lot less expensive than if you're paying for a premium plan at $1,000, $1,200, $1,400 per month that just has a small copay for you to go see a primary care doctor. In addition, that primary care doctor may or may not answer your calls or your texts. When you reach out, you may get an appointment a month from now or 2 months from now. This access that you have to this practice and this level of care makes a difference.
Yeah, and that HSA, I think the maximum contribution for a family is like over $7,000. So to be able to use your HSA funds, you're not even maxing out using all of your funds. It's just a portion of it. If you're maxing out the contribution, so to be able to use those funds, you're still going to have those available if you need to use them for your deductible.
I still think it's really important to contribute to one's HSA with those bronze level plans, because things happen, emergency visits,
of course,
surgeries, hospitalizations. That's what that special slush fund is for. And you probably know this, but your HSA funds grow and are invested if you're not using them, and you can use them in your retirement.
Yeah, which is great. Yeah. Well, awesome. So why do you think a patient should choose to see a direct care? I mean, I know why a patient should choose to see a direct care doctor, but why do you think a patient should choose to see a direct care doctor?
I think it's about access, and I think it's about comprehensive care, and all of that is built on trusting relationships. If you only have a couple of minutes with a provider, may not even be a physician, and it's transactional, it's just about your cough or just about your rash, I think we miss so much, and it contributes to our just general sense of just a lack of well-being that we have. Whereas if you have someone who's taking a holistic approach to all of you when you come in here, you might come in for a rash or a sore throat, but there's a lot more to you than just that. And I think that in this setting and in this model, we have the time to really address and sort of seek out those other things.
Yeah. So what I've noticed, I actually have a direct care doctor too, is that I feel cared for. I think that's what's lacking with the traditional models. Like you're like you said, very transactional. I don't feel cared for when I go. Like you just go and you get the super bill and you pay your copay and that's it.
Right.
So, yeah.
Right. And you might not see the same person from one visit to the next. If you have a question, God help you to try to get through a portal or a phone tree, just to ask a simple question about something that you might have forgotten that was mentioned in the course of the visit.
Right, and then you don't get that question answered, and
I had a funny thing happen yesterday. A patient and I were talking about her diet, just in the context of her overall health, and how she wants to eat differently for 2023. And I was sharing with her that during a recent visit to New Orleans with my son, we discovered this concoction that has millions of variations, and I've been using it since then. And it's plain whole Greek yogurt, pumpkin, like from a can, just pumpkin mix, and then all kinds of things on top of it, whatever you want. Pea shoots, bean shoots, pumpkin seeds. I noticed you had some of those in the kitchen.
Yeah, I do.
Fresh blueberries, grapefruit. I love grapefruit this time of year. Citrus, oranges, things like that. I change it up every day, but it's just a nice, healthy mix. That Greek yogurt is really good for gut health, as are the pumpkin seeds. But we were talking about this, and after she left, she texted me and said, "Can you remind me what was in that concoction we were talking about?" And so I sent her half a dozen pictures of different variations on that theme. So it kind of got us laughing again, even after our visit.
And that's fun. I mean, that's the other thing about practicing this way for me, and it sounds like for you, that it's fun.
It is fun.
Yeah.
Absolutely.
Yeah, cool. What do you think the biggest misconception is about you and your practice that you want to dispel?
Again, cost. I think the perception is that it's expensive, or that it's some sort of elitist model that very few can access or afford. And I just don't think that's true. I've outlined that pretty clearly already. That's been the big hurdle to building this practice.
Yeah, and I think also the time piece, like if you're waiting a long time to see a doctor, that you're losing time. You're losing time to feel better and living your best life and like that. So this is like, you have better access, quicker access to care.
Quicker access to care. If there's something bothering you, we get you in right away. And I'm not waiting until the next appointment to follow up with you. I'm texting you and checking in with you and calling you in the interim to make sure you're doing okay and we're on the right track together, because it's a partnership. It's not a transaction.
Yeah, that's awesome. So if people were to reach out and try to find you, and they're not connecting with their doctor and they want something different and they want to connect with you, how would patients reach you?
Absolutely. Just reach out and look on the website. It's HeidiLarsonMD.com. On the website, it lists all the things that I know how to do. I bring the benefit of years of training, 30 years experience. I'm Army trained, which makes me unique. And there are all kinds of things that I can do, and all of those things that I know how to do, I share with my patients at no additional cost. So $85 a month gives you access to me and all the things I know how to do for you right here in this office.
So let's talk about that. So I know you draw labs, you do exams, you do, tell me about some of the stuff that you might do.
Abscesses, draining abscesses, packing abscesses, skin lesion excisions. The pathology charge is separate, but I will excise the lesion and suture, close, and follow up on the wound, get the sample to the pathologist for analysis, and that's all included in the $85.
That's awesome. Yeah. So other things that you might manage are like high blood pressure, gout,
all the basics,
cholesterol.
all the things, diabetes, hypertension, atrial fibrillation, heart disease, stroke, depression. We see a lot of depression. I do medication management for people with substance use disorder. Suboxone needs to be destigmatized, and we can do that in this practice. It's really just one more thing on your list of medical problems for a lot of my patients.
That's great. Yeah. Well, thank you very much for taking the time. I appreciate it.
Thank you.